I will be introducing a common condition which is benign prostatic hyperplasia or BPH. BPH is a non-cancerous enlargement of the prostate gland which is an important part of the male reproductive system. It is also referred by other terms such as benign prostatic blockage or simply enlarged prostate. To understand BPH, there are two major growths, which is the first phase occurs during early adolescence when the prostate doubles in size. And the second phase begins around the age of 25 and it continues throughout the life. BPH is most likely to develop during the second growth phase, while it is not cancerous and it can cause significant discomfort and complications.
So for sign and symptom, benign prostatic hyperplasia is common in people over 50 years. The sign of benign prostatic hyperplasia, physical sign is enlarged prostate by using a digital rectal exam where the prostate feels enlarged, firm and smooth. Other than that was bladder distension, a condition where palpable or visible swelling in lower abdomen suggesting retained urine due to incomplete bladder empty. Moving on to the symptoms. The symptoms of benign prostatic hyperplasia have two: pressure on urethra and change in bladder. Patient have a pressure on urethra. It will give the symptom of difficult to urinate and also bladder not completely empty. Next symptom was change in bladder. So there are symptoms of pee more than 8 times, we call it frequency, strong need to urinate, we call it urgency, and also pain while urinate. The symptom of BPH tend to slowly get worse, but sometimes they start to same or even improve over time. The size of prostate does not always determine how serious the symptoms are. Some people with slightly enlarged prostate can have major symptoms, while others with a very enlarged prostate can have minor problems.
The pathogenesis of benign prostatic hyperplasia, or known as the BPH. BPH, a common condition affecting aging on men, particularly those over 50. So BPH developed due to the combination of the hormonal and cellular changes in the prostate. The key driver are the aging and the testicular function, leading to the alteration in androgen and estrogen level. So let's break this down step by step. As men age, testosterone level decline, but this doesn't stop the conversion to dihydrotestosterone (DHT) by the enzyme 5-alpha reductase (DHT). DHT, a more potent androgen, binds to the receptor of the prostate and triggers the cell proliferation. So, despite the declining in the testosterone level, intraprostatic DHT level remain high and driving the disease process. So, DHT stimulates the stromal and epithelial cell proliferation. Particularly in the transition zone of the prostate. So, over the time, it will lead to nodular enlargement of the prostate, which is a hallmark of the BPH. So, in addition to estrogen play a role, especially by promoting the stromal cell of growth via the estrogen receptor alpha. So the enlarged prostate compress the urethra, causing the obstruction of the urine flow. Symptoms include the difficulty urinating, incomplete bladder emptying, and frequent urination. If left untreated, it can progress to complications such as bladder damage or infection.
Now we'll continue with the clinical findings of BPH. So for the first one is elevated prostate specific antigen, or we call it as PSA. PSA or prostate specific antigen level may be increased in patients with BPH. This occurs due to increased prostate size and inflammation that is associated with this condition. The hyperplasia of prostate tissue also leads to greater secretion of PSA into the bloodstream, and therefore elevated PSA also can be an important marker but not specific to BPH, as it can also indicate other prostate conditions. Secondly, enlarged prostate on digital rectal examination. During a digital rectal examination, the prostate typically enlarged, smooth and firm, which is one of the characteristics of BPH. This enlargement is caused by the hyperplasia of glandular and stromal tissue. As the prostate enlarges, it compresses the urethra, resulting in obstructed urine flow. And for the last one, if the BPH is left untreated, it can lead to several complications, including bladder stone. It's developed due to incomplete emptying of the bladder that will create an environment for stone formation. And next is hydronephrosis. The obstruction of urine flow can cause back pressure on the kidney that leads to swelling or damage. And lastly is UTI, or urinary tract infection. The incomplete bladder emptying will increase the risk of bacterial growth that will lead to infection.
So I will continue on the key risk factor of the BPH. BPH is a condition that significantly impacts aging men, and understanding the risk factor is essential for the prevention and the management. So as men age, hormonal changes occur, including the increase of dihydrotestosterone (DHT) level and a shift in the testosterone to estrogen ratio. This change stimulates the prostate cell proliferation, leading to the gland enlargement. So elevated DHT and altered testosterone level directly promote the prostate growth. Next is systemic inflammation from obesity and metabolic syndrome contribute to increase of oxidative stress. Obesity exacerbates the hormone imbalance by increasing the estrogen level, decreasing testosterone, and further encouraging the prostate hyperplasia. Obesity is a growing concern in BPH. It leads to the hormonal imbalance, worsening prostate enlargement, abdominal fat increase, the systemic inflammation. Next is metabolic syndrome. A combination of insulin resistance, high blood pressure, and low HDL cholesterol create oxidative stress, and this factor drive prostatic tissue remodeling and hyperplasia. Move on to family history, play a crucial role in the BPH. So men with the close relative who have BPH are more likely to develop a condition of BPH. So this suggests a hereditary predisposition and potentially due to the variation of the androgen receptor sensitivity and gene involved in the prostate growth regulation. And last but not least is the age is the single most significant risk of the BPH. The prevalence of BPH increased significantly after age 50 and is almost universal in men over 80, remodeling the prostate tissue, further advancing the hyperplasia. So BPH is influenced by age, hormonal changes, family history, obesity, and metabolic syndrome.
For the lab diagnosis of BPH, the first method is the prostate-specific antigen blood test. Elevated PSA levels in the blood are a common finding in BPH. This elevation occurs due to the increased size of the prostate and associated inflammation. However, it is important to note that elevated PSA is not specific to BPH, which can also be seen in prostate cancer or any other infection. So this is why PSA testing must be interpreted alongside other clinical findings. Secondly is the digital rectal examination or DRE, which is one of the most important diagnostic tools for BPH. During this procedure, the physician insert the gloved finger into the rectum to feel the prostate gland located adjacent to the rectum. The third diagnostic method is cystoscopy. In this procedure, a thin tube with a camera is inserted into the urethra to directly examine the inside of the prostate, the ureter channel, and the bladder. This test is particularly useful for assessing the degree of obstruction caused by an enlarged prostate and identifying other abnormalities such as bladder stone. And lastly, we have the transabdominal ultrasound. This imaging test is non-invasive and measures the size of the prostate. And to add more, it helps evaluate bladder function by assessing how much urine remains in the bladder after urination. The retained urine can be a sign of BPH that related to urinary obstruction.
Moving on to the treatment. The treatment was chosen based on how severe the symptoms and how much they bother or affect the quality of life. There are three stages of treatment that will be given to the patient. First, watchful waiting, medicine, and also surgery. For the watchful waiting, patient need to do a yearly checkup, lifestyle change, drink fewer liquid, avoid or limit alcohol and caffeine. Also physical activities such as running or workout a bit, and empty the bladder completely before going to somewhere or even sleep. And then for the medicine, there are 4 types of medicine that will be suggesting for BPH patient, which is alpha blocker, which it relax the smooth muscle of the bladder, neck, and the prostate. And next, 5-alpha reductase inhibitor, which shrink the prostate. A professional healthcare provider will suggest to combine both alpha blocker and 5-alpha reductase inhibitors. And last medicine was phosphodiesterase 5 inhibitor, which it treat erectile dysfunction and enlarged prostate. If the BPH was severe, they will be suggested with surgery. There are several types of surgery. One of it was minimally invasive surgical therapy, which it remove enlarged prostate tissue and transurethral resection of the prostate, which it remove the prostate piece by piece. While for the prevention, researchers have not found the way to prevent BPH, but being physically active may help reduce the risk. So there are 4 steps to prevent BPH. First, maintaining normal cholesterol, blood pressure, and blood sugar level. Also, consume herbal supplement. It can reduce the risk of developing BPH, which it keep heart healthy, help shrink the prostate, and lower cholesterol. Other than that, individual can practice healthy diet, which they can consume fruit, vegetable, healthy fat, and also Mediterranean diet with like berries, broccoli, citrus, nut, tomato, and turmeric. Lastly, lifestyle changes like I mentioned before, which it can improve prostate health and also heart health. I think that's all for our mini project presentation. Thank you.
Hi, before start, can you introduce yourself first?
Alright, my name is Muhammad Berandi and I'm 21 years old and I'm currently doing MBBS course in the third year, clinical posting, which is surgery.
So during your study, have you heard the term benign prostatic hyperplasia (BPH)? And what does it different between BPH and prostate cancer in terms of symptom and prognosis?
Right. So BPH is a non-cancerous enlargement of the prostate, and it commonly affects the transitional zone of the prostate, and it usually causes urinary retention in the patient. But prostate cancer, it's not usually cause urinary retention. So to differentiate between these two, BPH and prostate cancer, we can do the investigation of PSA levels, biopsies, and imaging.
What are the most common symptoms of BPH in patient, and how these symptoms affect the patient quality of life?
Alright, so the most common symptoms in BPH patient is starting from urination, weak flow of urine, frequency of urination, especially at night, and also dribbling at the end of the urination. So all of these symptoms will disrupt the daily activities of the patient and cause sleep disturbances, and also increase the anxiety to access the restroom, which impact the quality of life of the patient.
So the next question is, what are the main causes or risk factors that increase the likelihood of developing BPH?
The primary risk factors of BPH is a man of 50 years of age and above, hormonal changes, which is increased level of dihydrotestosterone levels, which is DHT, and then obesity, metabolic syndrome, lack of physical activities, and family history.
Are imaging techniques such as ultrasound commonly used in the diagnosis of BPH, and what do they reveal?
Yes, imaging studies like transrectal ultrasound or TRUS is commonly used to measure the size of the prostate, to detect the structural abnormalities of the prostate, and to evaluate the residual urine in the bladder. So this can confirm the diagnosis of the BPH and also rule out the other conditions like bladder stones.
Hi.
Hi.
Okay, my name is Aisha, and I'm conducting a short interview to learn more about people's general knowledge about a common health condition called benign prostatic hyperplasia or BPH. It is part of a project that I'm working on right now, and your input will be really helpful for me. Can I ask you a few quick questions?
Yes.
So I will begin with question 1. Have you ever heard about benign prostatic hyperplasia before?
I'm not sure. I think no. I
No?
haven't.
You haven't? So BPH actually is a non-cancerous enlargement of the prostate gland. Okay, we move on to the next question. Do you know what BPH affects in the body?
Prostate?
Prostate? Yes. BPH affects prostate gland. It is a small gland in man, located below the bladder that produces semen, and it enlarges with age, causing urinary issues. Third question. What do you think causes BPH? Do you know? No?
I think no.
You don't know? So BPH is caused by age-related hormonal changes. Okay?
Okay.
So for the fourth question, can you guess the symptom of BPH?
Always want to pee.
Always want to pee. And yes, it is actually difficulty urinating and frequent urination. BPH causes the prostate to press against the urethra and narrowing it, which leads to weak urine flow, or the people with this condition will fail to urinate often. And for the next question, what do you think the proper treatment for BPH?
Surgery?
Surgery? Yeah, surgery, but surgery is for only severe cases. And the primary treatment for BPH is lifestyle changes or medication like alpha blockers. So that's all from me. Thank you so much for your time. And this information is very helpful for me. Thank you so much.
Thank you.